Hey there, let's talk today about general overview in cerebrovascular stroke awareness series. Stroke happens when there is a disturbance in cerebral blood flow leading to a sudden focal neurological deficit. Stroke is the second leading cause of death after heart disease, and sadly, most people who survive a stroke will have some kind of long-term impact. The most common cause of stroke is when blood flow is blocked, which happens in about 85% of cases. This blockage can be caused by a thrombosis or embolus from heart, carotid, or aortic arch getting stuck in the cerebral blood vessel. The other 15% of strokes happen when a blood vessel rupture, causing bleeding inside the brain, intracerebral hemorrhage, or in the subarachnoid space. We are going to focus on ischemic strokes, which are often caused by things like atherosclerosis, narrowing of carotid arteries at origin, bifurcation, or siphon, or problem with the aortic arch. Sometimes it is due to atrial fibrillation, left ventricular thrombus, or valvular heart disease. Other times it is caused by small artery disease causing lacunar infarction, or condition like dissection, vasculitis, fibromuscular dysplasia, subclavian steal syndrome. Sometimes the cause is just unknown. When blood flow to the brain is reduced, it can cause irreversible damage if the reduction is less than 10 ml per 100 gram per minute, leaving an ischemic core behind. However, the area surrounding the core, penumbra, may recover if timely revascularization is performed. The symptoms of stroke can affect the brain, retina, or spinal cord, leading to things like weakness on one side of the body, trouble with vision, speech, or balance. Sometimes the symptoms can be unusual and called stroke chameleons, like ataxia, vertigo, or confusion. When examining a stroke from a time-based perspective, we can encounter transient ischemic attacks, which are focal neurological deficits that resolves within 24 hours. Additionally, we may observe crescendo TIAs, characterized by multiple TIAs occurring more than twice within a 24-hour period, or three or more TIAs within a week. Lastly, the evolving stroke, which presents with fluctuating or progressively worsening symptoms within 24 hours without complete recovery. People over 60 and those with cardiovascular risk factors are at a higher risk for stroke. High blood pressure is a major risk factor, along with type 2 diabetes, high cholesterol, smoking, heart disease, kidney failure, and peripheral arterial disease. Stroke in the younger population may be attributed to factors such as fibromuscular dysplasia, vasculitis, hypercoagulability, or embolic vegetations originating from valvular heart disease. Time is of the essence in the aftermath of a stroke. Every minute that passes without appropriate treatment results in the loss of approximately 1.9 million neurons. That is why it is super important to quickly activate the stroke code and get a systematic clinical approach going. We should check the systolic blood pressure and examine the heart right away, and then do a targeted neurological exam, including cranial, motor, sensory, and cerebellar tests using the clinical assessment tools like the FAST and other exam tools. Additionally, we should conduct a comprehensive lab test, including CBC, renal function test, coagulation profile, serum blood glucose, serum electrolytes, creatine kinase, and troponin levels. Furthermore, we should perform stat imaging to confirm the diagnosis and rule out hemorrhage. We should also spot the site of occlusion and quantify the extent of damage. Once we have got the best medical therapy in place, like antiplatelet statins, controlling hypertension and diabetes, we can pursue intervention for large vessel occlusion, and it is a question of when, how, and who will intervene. If it is an intracranial visit, the neuroradiology intervention team can do intravenous thrombolysis and mechanical thrombectomy if it is between 6 and 24 hours. However, for the extracranial vessels, the vascular surgery team can do carotid endarterectomy or carotid artery stenting. Generally, the best results come from 2 days to 2 weeks after the stroke attack. In conclusion, we now have a comprehensive understanding of cerebrovascular stroke, including its etiological types, time-based types, possible causes and risk factors, clinical presentation, and appropriate actions when the stroke code is activated. it is crucial to recognize the involvement of medical and surgical teams in the management of stroke cases. Thank you and see you in the next time.